something that I really appreciated is that the skin texture here. This feels like a normal skin texture you would have of a patient. My name is Sarthak. I'm currently a medical student in Australia, and I have some background in registered nursing, which I've been working for the last 4 years. So working with the ProxSIMity IV Cannulation products today, I think it's first of all, how real does this look? This is a real hand right here. And a cool feature about it is that, you can replace these heads with, different patient conditions. So something that I really appreciated is that the skin texture here. This feels like a normal skin texture you would have of a patient, right? Just not like a silicone model that, so you're getting a real feel of, where the veins are, how the feel, and how bouncy sometimes the veins can be, and how fragile, how movement of the veins can happen really easily when you're doing an IV cannulation. So a few of the products that they had available, they had 5 different conditions available, from patients that are dehydrated to patients that have fluid overload and a lot of edema in their hands. And sometimes for those kind of conditions, the IVs can be really difficult. And I haven't personally seen anyone have a replication simulator of those conditions. So being able to work with the fact that, I can have someone with edema in their hands and kind of find veins and how difficult it can be, it's a great experience, great learning experience. And it's easy as putting them on and starting, your practice. So can't ask for more as a student or a professional.